Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing a Kahoot session, and we're going to be going over pharmacology, important meds to know in pharmacology. It's a quick session. I think it's only about 15 questions. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. Go ahead and press that thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And don't forget, I'm now offering next generation NCLEX reviews, private tutoring sessions, and consultation sessions. Also, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, and Facebook. My handle's the same on each platform, Nexus Nursing. Okay, guys, let's get started. Pharmacology. Your cancer patient's receiving bleomycin IV. You would anticipate which diagnostic study to be ordered. Would it be electrocardiography? Would it be echocardiography? Would it be radiography? Or would it be pulmonary function studies? Your cancer patient is receiving bleomycin IV. Which diagnostic test do you expect to be ordered in regards to this medication? Okay, very good. Pulmonary function study. So guys, this is an antineoplastic agent. You need to know this medication, and it can cause cystic fibrosis. It can cause lots of respiratory issues. So you have to be checking the lung sounds. You're going to be watching out for adventitious lung sounds. You're going to be watching out for rales, crackles, bronchi, wheezing, any adventitious lung sounds that you hear. By the way, as nursing students, I don't know why you hear adventitious and you think that's a good thing. No, those are bad. Adventitious lung sounds are bad lung sounds. You hear any of those, you have to notify the healthcare provider immediately, okay? Because the effects on the respiratory system, that is an adverse effect of this medication. Now, let's be clear. Very often, people will use side effects and adverse effects interchangeably, but they are not the same thing, okay? Side effects of medications are things that may possibly happen to the patient. You don't want it to happen, but you're going to warn them. You're going to tell them, hey, this may possibly happen, so they're not shocked. But adverse effects of medications, those are things that may possibly happen to the patient if they take the medication, but we do not want that we do not want it to happen under any circumstances. And we tell the patient, if this happens, you have to let us know right away, because you're expecting the healthcare provider to either change the medication or maybe change the dosage. You expect some type of augmentation to happen. That is the difference between side effect and adverse effect. Adverse effects are much worse than side effects. So if you're looking like in the drug book, and you'll see the side effects in black, but you'll see the adverse effects in red. The adverse effects are the effects that you, the nurse, have to report to the healthcare provider no matter what. Or if the patient's taking the medication at home, they absolutely must report to you, the nurse, so you can report it, or the healthcare provider immediately. Okay? So make sure you guys know this medication. Your patient with leukemia is being treated with bisulfan. Which lab value would be most critical to monitor? Would it be the clotting time? Would it be uric acid level? Would it be potassium level? Or would it be the patient's glucose level? Which lab value are you going to pay special attention to the patient that's taking this medication? Okay, wow. Most of you guys chose potassium, but the correct answer is uric acid. This medication, an adverse effect is hyperuricemia. It can cause an increase of uric acid in the blood. That's a problem, all right? So we'll be worried about the patient having kidney stones. We're going to be worried about nephropathy. We're going to be worried about their kidneys being able to filter out the toxins in the blood. Okay, this is what we're going to be concerned about. So you're going to be looking at the uric acid level. You're going to be looking at the creatinine level. That's going to be very important because you want to see what the kidneys are doing. because we're concerned about this patient going into kidney failure. How are you guys doing on the live? Alex said, wow, we need to study. That's okay. That's why we're doing this. You're getting it wrong now so that when you see this information again, you get it right then, right? Okay, let's keep going. You guys are funny. All right. Silver sulfadiazine is ordered for your patient with a burn injury. Which lab finding would need immediate follow-up? Would it be the glucose of 99, a magnesium of 1.5, platelet of 350K, or WBCs of 3,000? Which one needs immediate follow-up? Very good, WBCs. So I'm hoping you guys all chose WBCs because you knew the adverse effects and not that you just recognized the WBCs were out of whack, right? WBC is supposed to be 5 to 10,000, and this is 3,000. It's way too low, way too low. But I'm hoping that's not why you chose it. You chose it just because you understood the adverse effects of this medication. So let's talk about and by the way, guys, I'm sorry. If you are new to my channel, you're new to me. I have a speech impediment. I've always had it. You're just going to have to struggle through it, okay? But silver sulfadiazine, I know I just butchered the name, but you see it here. This medication is used to treat like burn patients, but one of the adverse effects, it can cause leukopenia. Leuko, type of a WBC, penia, little bit of, right? Little bit of WBCs. So WBCs help you fight infection. So if the patient doesn't have enough of them, by the way, your normal range for the WBCs is 5 to 10,000, that will put the patient in a position where they'll be immunocompromised. So when you see the patient on this type of medication, automatically you're going to be looking at those WBCs. You want to make sure they're within range. You want to make sure it's 5 to 10,000. You're going to be monitoring that patient for signs and symptoms of infection. Now, I want you to think about it. Go back to this question. Not only did I tell you what type of medication this patient was taking, I told you this patient was a burn injury patient. Let me tell you something, my friend. Whenever you get a test question, yes, and you see that the patient is a burn injury, automatically, before you even see anything else, automatically in your mind, there are a couple things that need to be going through your head. Number one, infection. Because remember, your first line of defense against infection is what? Your skin. And now skin integrity is decreased because of a burn. So you need to be concerned about infection. And excuse me, you need to be concerned about dehydration. Now, I'm getting off topic, but I want to talk to you about burns a little bit because I want to make sure you guys understand, because so many of you students get easy test questions wrong just because you don't understand. When a patient has burns, the reason you're concerned about dehydration, you're concerned about their fluid status, is because when there's been a major burn, there's going to be a major shift. And all of the fluid that was within the vascular space, it leaves the vascular space and goes out to the tissues. And that's why that burn patient looks swollen. They look swollen because all of that fluid is in the vascular space, but as swollen as they look, they're actually dehydrated. They're at risk for their organs going into shock, right? So we're going to pay special attention to the fluid electrolytes, dehydration, and of course, infection. Now, going back to this medication, when you see this medication, don't forget it. Adverse effects to this medication would include, like, patient getting a rash. It includes pruritus, where their skin's itching all over, and leukopenia. That's a big concern. So we're going to be looking at the patient's WBCs. All right, this is a select all that applies. You're applying topical corticosteroids to a patient with eczema. Where should the medication be applied? Select all that applies. Now, if you've been following me for any amount of time, you know that you treat select all that applies as true or false. So here are your choices: back, soles of feet, palms of hand, face, neck, genitalia. You're applying topical corticosteroids to a patient with eczema. Where should that medication be applied? Back, soles of feet, palms of hand, face, neck, and genitalia. What do you guys think? Okay, let's talk about it. So the correct answer, back, soles of feet, palms of hand. The thing is, guys, topical corticosteroids, this is absorbed systemically. And so you want to stay away from places of high absorption, like face, neck, genitalia, axillary areas, right? Those are places of high absorption. It's going to be absorbed too rapidly. Let's talk about corticosteroids for just a second before I move on. We know that corticosteroids, they are great medications for decreasing inflammation, but the minute you see corticosteroids, I don't care about the patient's diagnosis, you see corticosteroids, there are actually four things that automatically need to be going on in your mind that you need to be worried about, you need to be concerned about as a nurse, okay? Corticosteroids are wonderful, they decrease inflammation. However, they mask signs and symptoms of infection because they decrease inflammation. So you better be monitoring your patient much more closely for infection. That's number one. Number two, steroids are very hard on the stomach. So if the patient's taking steroids PO by mouth, you better make sure you teach that patient to take it with foods because it can cause gastric ulcers. Number three, steroids are very sugary, right? You better be checking that patient's glucose levels because it can cause hyperglycemia, especially in a diabetic patient. And number four, steroids make the bones porous. So if the patient's on steroids for any extended amount of time, we're going to be concerned about fractures. This is a safety issue, right? We don't want the patient's bones to get porous. So make sure whenever you see steroids, you're thinking about those four things. How are you guys doing on the live? Okay. Your newborn patient's mother asks you why you just applied erythromycin ointment to the newborn's eyes. What would your response be? What's the correct answer? Would you tell the mom it's to protect the newborn from possible infections acquired in the hospital? Would you tell her it's to prevent cataract in the newborn? Would you tell her it's to prevent ocular varicella in the newborn? Or would you tell her it's to prevent bacterial infection caused by gonorrhea? What's the correct answer? Very good. That's correct. It prevents bacterial infection caused by gonorrhea, and this is mandated in every single state in America, okay? You have to do this for every single newborn, so you have to explain to the parent why. What's the rationale for administering a vitamin K injection to a newborn? Why would you give vitamin K to a newborn? What's the rationale? Is it to improve immunity? Is it to prevent jaundice? Is it to promote probiotic growth of the GI tract, or is it to prevent bleeding disorders? How are you guys doing on the live? Okay, very good. Keep answering. Even if you don't know the answers, try. Very good. It prevents a bleeding disorder. So guys, think about it. Newborns are born with a sterile GI tract. Their gut is sterile, right? And so they don't have any bacteria in their gut, and a certain type of bacteria that helps to make that clotting factors. They don't have it. So that newborn is really not going to even start making that type of bacteria that'll help make the clotting factor until they've had a couple meals, and then they'll have the bacteria. So that's why the newborn will get the vitamin K injection. Very good. Almost everyone got that right. Select all that applies. You're giving oxytocin to your patient in labor. What would make you immediately stop the infusion? Select all that applies. Fatigue, drowsiness, uterine hyperstimulation, late deceleration, early deceleration, panting. What do you guys say? You're giving oxytocin. What would make you immediately stop the infusion and call the healthcare provider? Okay, so let's talk about it. The correct answer choices is uterine hyperstimulation and late deceleration. So oxytocin, this is a medication used very often, like, to induce labor. It causes uterine contractions, right? If this medication works a little bit too well, it may cause uterine hyperstimulation. And here's a tip. If you guys don't know what the answer is, but you're looking at the choices, if anything that says hyper in front of it, hyper as in too much, do you think that would be a good thing? No, right? So yes, we're giving oxytocin to stimulate contraction of the uterine, but we don't want it too much. We don't want to cause hyperstimulation. And late decelerations, that is bad. When you see late decelerations, that shows fetal distress. But fatigue, no. Guess what? She's in labor. She's going to be fatigued. Drowsiness, no. Oxytocin doesn't cause the drowsiness. Early decelerations, actually, that's a good thing. We see good communication between that baby, the fetus, excuse me, brain and heart, no issue with that. And panting, we expect them to be panting during labor. All right? I want to point something else out to you, because this is another common mistake that you guys make as students. Look at the question. You're giving oxytocin to your patient in labor, da, 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 da. The key in this question is oxytocin, this medication. So whenever you're looking for your nursing intervention, whenever you're looking for your priority, whenever you're looking for the answer, it's going to be in relation to this medication. Many of you students pay attention to the patient's diagnosis. This is a diagnosis labor, but this is what's happening to the patient, right? So if you were paying attention to the labor, then you'd be looking at panting or fatigue or drowsiness or anything else. But we don't care about the labor. What we care about is the medication. Whenever you get a test question and it says you're about to administer a medication, or you just administered a medication, I don't care if they give you the patient's diagnosis, the background, blah, blah, blah. What we care about is that chemical that we're about to put into the patient's body, or that we just put into the patient's body. And that's what we're addressing. That's what our nursing intervention is going to be aimed towards. So don't be distracted by that diagnosis. Don't be distracted by what else is going on with the patient, because those are distractors. What we care about is what we're about to put into that patient, or what we just put into that patient. That's what our focus is going to be on, okay? Am I going too fast for you guys on the live? Or are you good? Okay, good. Let's keep going. This is another select all that apply. You just gave magnesium sulfate to your patient in preeclampsia. Which signs and symptoms of toxicity would you be alert for? Here are your choices: proteinuria, respirations, deep tendon reflexes 2+, serum magnesium level of 10, urine output of 20 mLs in an hour, heart rate of 98 beats per minute. Okay, someone in the live asked for the Kahoot code. The code is 462-7270. 462-7270. That is the code for this Kahoot. All right, let's talk about this, because I just gave you guys a long speech. Remember, before this started, I promised, well, I didn't promise, but I told you guys I tried not to yell. So I'm watching my tone. I'm not going to yell at you guys. I'm going to speak very calmly. But I just gave you guys a speech. And I just told you not to pay attention to distractors, pay attention to the medication, not to pay attention to the diagnosis. So please explain to me how I told you that your patient is getting magnesium sulfate and they have preeclampsia. What signs of toxicity would I be alert for? How did 49 of you guys choose proteinuria? We see proteinuria in the diagnosis, which is preeclampsia. but we're not paying attention to preeclampsia. We're paying attention to the medication, magnesium sulfate. How? I'm watching my tone. Don't do this, guys. This is how you guys get easy questions wrong. You're making this common mistake. Train your mind, okay? Proteinuria is not the answer because proteinuria, that's part of the diagnosis. We're looking for magnesium sulfate. We're looking for signs and symptoms of toxicity for magnesium sulfate. Let's think about it. What does magnesium sulfate do? Magnesium sulfate depresses the CNS, right? So, excuse me. So we're going to be looking for those signs and symptoms of decreased CNS. We're going to be looking for everything going down, decreased respirations, decreased heart rate, decreased deep tendon reflexes. We're looking for signs and symptoms of that magnesium sulfate being too much, working a little bit too well. So we're not going to choose proteinuria because in proteinuria, that's part of preeclampsia. That has nothing to do with the medication, right? Next, respirations of 8. That's the correct answer. Why? Because we know that magnesium sulfate brings everything down. And if it works a little bit too well, the patient gets a little bit too much, right? It'll bring the respirations down. Respiration is supposed to be 12 to 20. What are we doing with respiration of 8? That's a sign and symptom of toxicity. Let's keep going. Deep tendon reflexes of 2+. 52 of you guys chose that. Why? That's normal, right? 0 and 1, they have decreased reflexes. 3, 4 is increased reflexes. 2 is normal. So why would we choose that? That's not a sign and symptom of magnesium sulfate toxicity. If anything, when it comes to magnesium sulfate toxicity, we would have saw the deep tendon reflexes at 0 + 1, right? Not 2. 2 is normal. What about magnesium sulfate, serum magnesium of 10? Absolutely. Think about it. Your regular therapeutic range is 4 to 7.5. That is your therapeutic range for the magnesium. Why is this patient so high at 10? Because they got too much. That's a sign and symptom of toxicity. Next, urine output of 20. Yes, that is a sign and symptom of toxicity. Why, Professor D? Okay, remember I told you that magnesium sulfate brings everything down, right? That patient gets too much, they're not even urinating the way they're supposed to be. Normal urine output's supposed to be what? At least 30 mLs per hour. Why is this patient only releasing 20 mLs per hour? Toxicity. And last, I'm happy only 9 of you guys chose heart rate of 98. There's nothing wrong with a heart rate of 98. Normal heart rate's supposed to be 60 to 100, right? We'd see signs and symptoms of toxicity if that heart rate was less than what? 60. So for this question, the correct answer choice is low respirations, high magnesium level, and of course, low urine output. If your patient's in the restroom when you enter to administer PO meds, is it okay to leave the meds at the bedside? True or false? So you go into your patient room to give them their PO meds, but they're in the bathroom. The statement says that it's okay to leave the medications at the bedside. Is this true or is this false? Very good. That is false, right? You have to watch your patient take their medications. And remember, you're giving your patient their medications. You're explaining to them what medication you're giving to them, why you're giving them the medication, what may possibly happen. And you're going to tell them, to press the call bell if you need anything, all that good stuff. So absolutely, you are not going to leave that medication at the bedside. And you have to verify that this is the right patient that you're giving the medication to. Select all that applies. You just administered medicine to the wrong patient because you did not check. Which nursing actions are most appropriate? Select all that apply. Here are your choices. Monitor for adverse reactions. Document the error if the patient has an adverse reaction. Report the error to the healthcare provider. Notify the legal department of the error. Document the error in the incident report. Document the error in the medical chart. Select all that applies. You gave medicine to the wrong patient. What are you going to do? Okay, let's talk about it. I'm very proud of you guys. Good job. So you realize you gave medicine to the wrong patient. Obviously, yes, you're going to monitor for adverse reactions, right? You want to correct the issue as soon as you realize there is an issue. You're going to report the error to the healthcare provider. You absolutely have to, because what? You may need new orders for that patient, and you're going to document the error in what? The incident report. The incident report is never in the patient's medical chart. This is going to be somewhere else. It's a third party, whether it's in the computer, it's somewhere else, or maybe it might be in a binder or folder, but it's never in the patient's chart, okay? An incident report, that is to help the company, the facility, the healthcare providers do better next time. Is to help them see what mistake was made, what error was made, how it happened, so they can come up with policies to prevent it from happening again. Matter of fact, you can't even mention the existence of an incident report in the patient's chart. The patient's medical chart is exactly what it is, their medical chart. You cannot even mention the existence of an incident report. The incident report is for the company, the facility only, okay? So you are not going to document the, look at this. Document the error if the patient has an adverse reaction. So if there's no adverse reaction, we're just going to pretend like it never happened. We're not going to tell anybody. False. And this is why when you do an incident report, you're not supposed to you're not supposed to be punished. This is a teaching opportunity, because if you're punished, who's going to report incidents, right? So you absolutely must report it. And as a healthcare worker, you should expect, education, but not to be punished. Now, guys, real world and NCLEX world are two different things. So I know you guys are going crazy. Adila said we have to snitch. I know you guys are going crazy on the live. When you're testing, remember, you're testing in the perfect world. It's NCLEX and not real world. Next, notify the legal department of the error. Note. You notify the healthcare provider and your immediate supervisor, and they will bring it up the chain of command as necessary. And next, document the error in the medical chart. You never do that. The healthcare provider wrote an order for digoxin, but you can't tell if the dosage reads 0.25 milligrams or 0.125 milligrams. Which action would be best to take? Would it be to check with the experienced nurse manager? Would you check the drug handbook for the therapeutic dose? Would you check with the pharmacist about the correct dose? Or would you check with the healthcare provider to clarify the dose ordered? Very good. You're going to check with the person who wrote the order. If you can't understand what they wrote, go back to the source and you clarify. Now, if you have a question about a medication, not the order, not the prescription, but the actual medication, you have a question about the therapeutic range, you have a question about adverse effects. In that case, you have two options. You can contact the pharmacist, or you can check with your drug handbook. You can't go to the healthcare provider about that. If you have a question about the actual medication, your two options is a pharmacist or the drug book. But if you have a question about a prescription, a drug order, you only have one option. Go to the person who wrote the order and clarify what the order is, okay? After administering lorazepam Ativan, you would assess your patient for the development of which adverse effect? Tachypnea, astigmatism, ataxia, or euphoria? What do you guys think? Okay. And only 30 of you guys chose ataxia. So let's talk about lorazepam, because I think most of you guys don't know what lorazepam is. Lorazepam, this is a benzodiazepine, and what it does, guys, it decreases the CNS. It decreases CNS activity. So we would not see tachypnea. So when it comes to this medication, we'd be concerned about that medication working a little bit too well, right? And so ataxia, you know, when the person's walking, but you know, they're walking like they're drunk, right? Safety. This is going to be a huge safety concern. So that's what we're going to be concerned about. Remember I said this benzodiazepines, they decrease CNS. So the patient will have things, they may have confusion, disorientation. They may have blurred vision. They may have just, what else am I thinking about? Well, ataxia, that's the answer, but you're always, oh, I forgot to put my phone on do not disturb, but you're always going to be concerned about safety when it comes to this medication. It's very important. You're going to teach a patient when they're on this medication, especially when it's new, not to operate heavy machinery, not to drive until they're used to the effects of this medication, because safety is a very big issue. Ataxia is the correct answer choice. You're working in the ER and your new admit is diagnosed with a migraine headache. What drug do you expect to be ordered? Morphine, propranolol, ibuprofen, or sumatriptan? You're working in the ER, your patient's diagnosed with a migraine headache. Which medication do you expect to be ordered? Very good. So that medication, sumatriptan, the triptans are used for like abortive therapy, like to stop the migraine headaches. So that's what you'd expect to be ordered. A morphine, that is a narcotic, use it for analgesic. Propranolol, that's a beta blocker. We'd give it for like blood pressure, hypertension. You know, we'd use it as an antihypertensive medication. And ibuprofen, Motrin, that's an NSAID. This patient has a migraine headache, not just a headache, a migraine headache. You'd expect something like a triptan to be ordered. You're teaching your patient about atorvastatin. Which symptom related to this drug would I can't read. Okay, you're teaching your patient about atorvastatin, Lipitor. Which symptom related to this drug would you teach them to report immediately? It is constipation, increasing muscle or joint pain, hemorrhoids, or hot flashes. Medication is atorvastatin, Lipitor. Very good. Increasing muscle or joint pain. By the way, if you go on for your NP, you want to be a nurse practitioner, this concept, you're going to see it on your test as well, most likely. Okay. So you need to know about this type of medication. It can cause rhabdomyolysis. That is an adverse effect. You're going to teach the patient, if they have any, muscle pain, to report it immediately, because this is a potentially deadly adverse effect that can happen. Last question. Select all that applies. You're teaching your anemic patient about ferrous sulfate. Which instructions should be included? Select all that applies. Take it on an empty stomach, take it on a full stomach, increase fluid intake and increase fiber. Take the drug before bed for best results. Drink with orange juice, decrease fluid intake and fiber when on this drug. What do you guys say? The Excuse me, guys. Excuse me. Wow. All right, let's talk about this. First of all, ferrous sulfate. What is that medication? What's it known as? Those in the live, please type it in. What is ferrous sulfate? Iron. Fancy word for iron. Your patient's taking iron. What are we going to teach them? We're going to teach them to take it on an empty stomach. Only 39 of you guys chose this. Let me tell you something. You need to know that. Iron needs to be taken on an empty stomach. We don't want that iron fighting for what is the word I'm looking for? I'm sorry, guys, I'm having a brain fart. Receptor sites. There we go. So you're going to teach that patient to take it in the morning on an empty stomach with orange juice or anything that has ascorbic acid, because they need the ascorbic acid, that vitamin C, for the iron to be absorbed. So taken on an empty stomach, true. Increase fluid intake and increase fiber, true. Why? Iron causes constipation. And so you're going to teach a patient to increase fluids, increase fiber, and increase activity. Make sure they're moving about. We don't want them to develop constipation. And drink with orange juice. Why? Orange juice is high in vitamin C. Again, you need that vitamin C. You need that ascorbic acid for iron to be absorbed. So you're not going to take it on a full stomach. It's going to be empty stomach. You're not going to take it before bed. You're going to teach them to take it in the morning before eating. And you're not going to decrease fluid and fiber. You want to increase fluid and fiber. And guys, that was the last question. I have so many more medications that I need to cover with you guys, because there are a lot of very important meds you guys need to know for NCLEX, ATI, and HESI. So there are going to be lots more pharmacology coming your way. Before we get to the scores, everybody that's watching this from YouTube, thank you so much for watching. Don't forget, I'm now offering next generation NCLEX reviews, so you can reserve your spot right now by going to my website, nexusnursinginstitute.com. All right, guys, let's see how you did. Okay, guys, thank you for watching. Please let me know what you thought about this video. Let me know what you thought about this Kahoot session, what you would like me to cover next or more extensively, and what format you'd like me to cover it. Do you like the Kahoot activity format? Do you want it in a lecture where I'm teaching out of the book, or maybe question and answer format, such as the videos that are released every Sunday, 1 p.m. Eastern Standard Time? So please sound off in the comments. And don't forget, if you're studying for your boards, go ahead and book a review, Next Generation NCLEX review, with me on my website, nexusnursinginstitute.com. If you're a nursing student and you are struggling, you are in the program, you need to pass, go ahead and check out my audio lessons that I have available on my website, again, nexusnursinginstitute.com. Guys, thank you so much for watching. You guys will catch me on the next video.